Men, be honest. When was the last time you looked at the one part of your body that defines so much of your confidence? Most guys don't. That's why this message matters. For men over 25, 7 HIV-related penis symptoms can appear quietly, weeks or months before you feel sick. And yes, I'm sticking to 2025 US data. The picture today is clear. In 2023, roughly 39,000 Americans were diagnosed with HIV. More than 80% were men, with most diagnoses among ages 25 to 44, and the South carrying the heaviest load. About 21.6% were already stage 3, AIDS at diagnosis, a reminder that subtle early signs still get missed. I'm Dr. Jame, urologist and HIV specialist, 2 decades in American clinics. My promise is straightforward. I'll teach you to spot 7 small signals on your body, explain the science, and show a plan you can start tonight. Listen with focus. I won't scare you, I'll equip you. These are updates men before you wish they had, so you won't repeat their delay. If you switch off now, odds are you'll end up in a clinic anyway. But stay with me and you'll meet Jack, a cautionary story that turned guessing into action for countless men. Every solution I give comes directly from years of clinical experience helping men live safely, confidently, and stigma-free with or without HIV. And remember, number 9 is the number that always moves forward. If you truly care about your health and your future, comment number 9 right now. Even one simple subscribe means a lot to me. It motivates me to spend more time creating valuable videos that help men and families in our community live healthier lives. Ready? Let's move forward. Calm, informed, in control. Hey man, if anything you hear next sounds serious, stay calm. You're not alone. A lot of men watch their penis closely and still miss small signals. Listen closely now. Last month, Jack, 25, rushed into my clinic, pale but hopeful. "Doctor, please help," he said. 2 weeks after sex, I noticed something. I asked a few focused questions and confirmed what to look for. Recognition. A tiny, flat, flesh-colored bump that doesn't hurt and survives 10-14 days. It may appear alone, or as a small cluster that's easy to miss unless you check under bright light. Biology. Early immune shifts can weaken the skin's barrier and spark microinflammation. That's why these bumps heal slowly and tend to recur, especially if you shave, have friction, or use harsh soaps. Self-check tonight. After a warm shower, dry gently, stand under strong bathroom lighting, and scan the glands and shaft. Photograph anything unusual, add today's date, and set a reminder to recheck in a week. When to see a doctor. If the bump lasts beyond 14 days, spreads in a cluster, or keeps returning, book a visit and ask for an HIV test plus a full STI panel. Now, my question for you. Have you seen a small, painless bump that outlasted a week? Comment 1 if yes, so I can guide you in the next section. If not, keep going, because the next sign looks harmless too, and many men ignore it until it returns again and again. Let's move into symptom 2. Quick gut check. Have you felt a light itch on your penis lately? It sounds harmless, but often it isn't. In Jack's case, the itch brought friends. Here's what it looked like up close. Recognition. A mild, recurring itch around the glands or under the foreskin, with fine flakes after showers and a faint redness that fades, then returns when you stop using cream. Biology. Early immune changes weaken the skin barrier and disturb the local microbiome. That imbalance dries the tissue, increases sensitivity to heat and sweat, and turns simple friction into a slow, smoldering irritation. Self-check tonight. Skip harsh soaps. Rinse with lukewarm water, pat dry, and let the skin breathe. Note flare dates in your phone. If it cycles back, you have a pattern, not a mystery. When to see a doctor. If the itch or flaking returns 2 or more times in a month, ask for an HIV test and a full STI screen. We may also discuss PrEP to protect you going forward. Recurring itch even after cream? Comment 2, so I can guide your next steps in the solution section. If you have passed through 2 symptoms without seeing yourself here, good, truly. Type, let's go, and we'll keep moving. Because the next sign can show up before you feel sick at all. A subtle odor or a thin morning discharge that many men dismiss as just hygiene. Stay with me, and we'll make it unmistakably clear. Don't stop here. This one is sneaky, and it worries me the most because you can't always see it. You notice it with your nose. It may feel awkward, but it's the truth. Back to Jack. One morning, he spotted a faint crust in his underwear. He gently pressed the tip, and a sharp, almost metallic smell rose from his penis. That's exactly how I want you to recognize this sign. Recognition. A thin, cloudy residue at the meatus in the morning. An unfamiliar or metallic odor. Or a light film that doesn't stain but keeps returning. Biology. When immunity dips early, the urethral microbiome shifts. Bacteria and yeast fall out of balance, creating odor changes and a barely visible discharge even without pain or burning. Self-check. Tomorrow morning, before you urinate, use a clean tissue to press the tip once. Look for a light stain, cloudy, yellowish, or white, and note the date. When to see a doctor, if the odor or discharge lasts beyond 5 days, or appears even without recent sex, ask for a urine NAT for STIs and an HIV test. Those tests see what eyes can't. Have you noticed a new smell or thin discharge for several days in a row? Comment 3, so I can guide you in the comments. If not, drop a positive, funny sticker and keep learning. Awareness helps everyone. In the next section, we'll move from what you can smell to what you can feel. A painless groin lump that many men ignore for weeks. Stay with me. Your early attention is your best protection. What do you know about lymph nodes? They rarely hurt, yet they can feel like a small object in your groin fold, and the moment your fingers find it, worry jumps. That's what happened to Jack on his 3rd visit. Eyes wet, voice shaking. "Doctor, what is this? Is it cancer?" he asked. I examined him, settled him, and explained the basics. This is a lymph node doing its job. Recognition. A soft, movable, bean-like lump high in the groin crease that doesn't hurt and lingers beyond 2 weeks. It may be on one side or both. Biology. Lymph nodes are filters in your immune army. When viruses or bacteria enter through sex, nearby nodes enlarge as they trap invaders. Early HIV can make this work over time without pain. Self-check tonight. Stand before a mirror, bend one knee slightly, and run your fingertips along each groin crease. Compare sides. A normal area feels flat. A swollen node feels like a smooth bean sliding under skin. When to see a doctor? If the lump lasts beyond 2 weeks, grows, or you can feel multiple nodes, schedule a visit. Ask for a blood panel and an HIV test so you replace fear with facts. Have you felt a painless groin lump that stayed too long? Comment 4. I'm here and I'll help you sort it out. Next, we'll tackle the sign that hides inside hormones and mood, when desire and performance fade. Still with me? In 60 seconds, we're touching a topic every man cares about. Quick personal check. Has your sex frequency dropped lately? Or do you feel more tired, distracted, or less confident than usual? When Jack returned a month later, he said it plainly. His desire had faded. Erections felt weaker and he kept blaming stress. Yet nothing else in his life had changed. Recognition. Persistent lower libido, fatigue, and softer or shorter erections without a clear trigger like new medicines or heavy alcohol. Biology. When the immune system is under pressure, the body prioritizes survival over reproduction. In early infection and other inflammatory states, brain test signals shift. testosterone can dip, and penile blood flow quality suffers. Self-check, 14 days. Track bedtime, sleep hours, morning erections, mood, workouts, alcohol, and porn use. Patterns tell the truth our memory edits. When to see a doctor? If the trend continues, ask for an HIV test, a morning total testosterone, and a blood panel, CBC, fasting glucose, TSH. These rule out hidden causes and point us to a fix. Noticed your desire or performance sliding. Comment 5. I'll share a simple at-home routine that beats pills for many men. Sleep, strength training, morning sunlight, hydration, and friction-reducing lube habits. Next, we shift back to what you can see: recurrent redness or fine, dry cracks on the foreskin. It looks minor, returns after showers or sex, and tells us the skin barrier needs attention. Before we dive in, are you okay? This one is intimate and can trigger worry fast. Back to Jack. He snapped photos. Voice shaking on voicemail. "Doctor, what is happening to me?" I messaged him to breathe and look again. What he saw matched a common pattern: thin, dry cracks and mild redness on the foreskin. A sting after showers or sex. Brief improvement, then another flare. Recognition: redness, dryness, or thin fissures around the foreskin that recur, sometimes with a faint burn after heat, sweat, or friction. Biology: low-grade, chronic inflammation when the mucosal barrier is weak and the microbiome is off balance. It often mimics a simple yeast rash, so men treat the surface while the issue lingers. Self-check tonight. Skip harsh soap and fragrance. Rinse with lukewarm water, pat dry, and apply petrolatum. Wear breathable underwear and track flare dates in your phone. When to see a doctor? If this returns multiple times in a month despite gentle care, pause sex until the skin settles and ask for HIV/STI screening plus a dermatology or urology exam. Bring photos and a flare timeline, details, speed, answers. Do you see repeating redness or dry cracks on the foreskin? Comment 6. If yes, take a break from sex. I'll outline an at-home routine in the comments. Our last sign shifts from skin to sensation, tingling or numbness after ejaculation. It's quiet, easy to ignore, and worth your attention next. This part is about you. When care is delayed, a seventh pattern shows up. A brief tingling or numb, sometimes a cool, cold cap feeling at the tip after ejaculation. Back to Jack. Because he lacked a plan, he noticed that sensation after sex. It faded in minutes, then returned on random nights. Recognition: a transient pins and needles or light numbness at the glands after climax. Occasionally it feels cool or less alive, even without pain or rash. It may follow friction, dehydration, or long edging sessions. Biology: early peripheral nerve irritation can happen when small nerve fibers are inflamed. HIV and other inflammatory states may sensitize these fibers and change how signals travel. Anxiety amplifies the perception, but biology lights the first match. Self-check. Log the frequency. If it happens more than 3 times in a month or any episode lasts over 24 hours, get examined. Track sex timing, hydration, alcohol, sleep, and lube. When to see a doctor? Ask for a focused neuro exam, an HIV test, and screening for vitamin B12 deficiency, thyroid issues, diabetes, and pelvic floor tension. We also rule out prostatitis and medication side effects. Have you felt tingling or numbness after ejaculation? Comment 7. If not, breathe easy and keep learning. We've covered 7 signs from skin to sensation. Next, a thank you, then the rule that turns awareness into action. See, sense, scan. Stay with me. This is where your plan gets clear. If you're still with me, thank you. Men rarely talk about this, but you just did the hard part. listening without panic. Drop a single dot in the comments to tell me you're here, or share one short experience, no details needed, so another man feels less alone. Your voice helps this community grow up strong and stigma-free. Ready for the plan? Next comes the simple rule that makes prevention practical. See, sense, scan. Grab a pen and a scrap of paper. This part stays short on purpose so you can implement it tonight. See, 1 minute after your shower, under bright light, look without judgment. Scan the glands, the shaft, the foreskin edges, the groin crease. Note any new bump, redness, crack, film, odor change, or tender spot. Sense. Pay attention to what you feel when you move, sweat, or have sex. Light itch, dryness, sting after soap, a subtle smell, a painless groin lump, tingling after climax. Your body whispers long before it ever shouts. Scan. Turn awareness into facts. Test every 6 months at minimum or sooner with any new sign. Ask for an HIV test plus an STI panel. Discuss PrEP for prevention and PIP within 72 hours after a high-risk exposure. If this rule helps, tell me in the comments. Type, "I'll do it," or just drop a dot and I'll know you're with me. Next, we'll cover the 5 mistakes that erase hard work, self-diagnosing, shame, trusting a single negative, ignoring small signs, and waiting for a crisis. Fixing them makes C-Sense scan unstoppable. Which mistakes do we keep repeating? Jack fell into all 5, so 7 symptoms stacked up before he saw me. Mistake 1. Self-diagnosing and self-medicating. Googling, buying creams, swapping soaps. Quick relief hides the pattern and delays the truth. If a problem lasts beyond 10 days, stop guessing and get examined. Mistake 2. Shame and silence. Embarrassment builds a wall to early care. Doctors see this every day. Speak early. Waiting shrinks your options. Mistake 3. Trusting a single negative test. There is a window period. Retest at 4 to 6 weeks, then again at 3 months after a risk. 1 result gives calm. 2 gives certainty. Mistake 4. Ignoring small signs because they don't hurt. Early HIV is often painless. Redness, thin discharge, a bean-like groin lump, or tingling after climax are quiet alarms, not background noise. Mistake 5. Waiting for a crisis. Weight loss, fever, night sweats, or repeated infections mean the virus has momentum. Don't wait until your body schedules the visit for you. CTA. Be honest with yourself. Which mistake shows up in your story? Comment 6, and I'll point you to the right next step and tools that actually work. Bridge. What comes next? Next, we turn mistakes into a nightly habit stack. The 3-step routine that protects your health and restores confidence without reaching for pills first. Here's a clear 3-step plan. If you can't catch every word, jot it down and post it on your mirror. Step 1. Observe once a month, 1 minute after your shower. Stand under bright light. Scan the glands, shaft, foreskin edge, and groin crease. Look for new bumps, redness, dry cracks, thin morning film, odor changes, or a bean-like lump. Snap a dated photo if something lingers. Step 2. Test every 6 months, sooner if anything changes. Ask for an HIV test plus a full STI screen. If you had a recent high-risk contact, talk about PEP within 72 hours. If you are sexually active and want extra protection, discuss PrEP and routine follow-up. 2 scheduled tests a year beat 12 months of guessing. Step 3. Strengthen your system so recovery is faster. Eat real food, not ultra-processed. Sleep 7 hours most nights. Train your body 3 times a week, even brisk walks count. Cut alcohol and smoking in half this month, then half again next month. Use lube to reduce friction. Harsh soaps off the list. Tell me when it helps. If you apply this routine, report back when you notice more energy, calmer skin, or better confidence. Your progress helps other men commit and stay consistent. What's next? You've got the habits. Now we'll tie everything together with a briefcase snapshot and a final message, so your plan feels simple, doable, and repeatable tonight. Jack came in scared but curious. He used C-Sense scan exactly, looked nightly, noted a cluster bump, sensed recurring itch, then scheduled testing instead of guessing. His HIV and NAT were negative, but the pattern told us to start prevention. We discussed PrEP, skin barrier care, and a 6-month testing loop. 2 weeks later, he messaged, "I finally slept." That relief matters. Fear shrank because he had a plan, not because symptoms vanished. 6 months on, he reports steady energy, clear skin, and 0 panic cycles. Optional snapshot. Daniel tested early after exposure, started treatment fast, and reached undetectable quickly. UU means undetectable equals untransmittable. He lives normally, dates confidently, and keeps his follow-ups. Your turn. Follow the rule, book your tests, and choose clarity. Next, I'll wrap everything into one final message you can act on tonight. Thank you for staying with me. Here is your clear, updated takeaway for today. 7. Early. Penis-focused signs form a pattern, not a verdict. Small, painless bumps that do not heal, itching or fine flaking, a new odor or thin morning discharge, a painless bean-like groin lump, lower libido or softer erections, recurrent foreskin redness or dry cracks, and tingling or brief numbness after ejaculation. Treat them as a chain of quiet signals. One on its own may be harmless. Several in sequence deserve attention and testing. Your simple rule is see, sense, scan. See your body under bright light for 1 minute after a shower. Sense small changes when you move, sweat, or have sex. Scan with scheduled tests, every 6 months at minimum, sooner if something changes. Ask about PrEP for prevention and use PEP within 72 hours after a high-risk exposure. Avoid the 5 traps that keep men stuck. Do not self-diagnose and self-treat. Do not let shame delay care. Do not trust a single negative during the window period. Do not ignore small signs because they are painless. Do not wait for a crisis. Live the 3-step routine. Observe monthly. Test twice a year. Strengthen immunity with sleep, real food, movement, less alcohol, and less smoke. Knowledge is power. Action is protection. Silence is risk. If this helped, comment the number 9 right now. It tells me you choose to move forward. Tap subscribe so I can keep building honest, stigma-free videos for men, partners, and families. Then make one small commitment tonight. Inspect after your shower, book a test, or message your doctor. You are not alone. With attention and steady habits, most fear shrinks fast. See early. Act early. Live fully. I'm here beside you with calm, practical guidance whenever needed today.